So everyone knows how to wash their hands, right? Okay, but have you ever tested yourself to see exactly how proficient you are? Let's do that right now. I use this hand lotion that leaves a glow-in-the-dark residue on my hands when used. Then I'm going to wash my hands to see how effective my hand washing technique is for removing the lotion. It stands to reason that if you're able to remove all of this from every part of the surface of your hands, then your technique is good. Now, I have to say first, don't get discouraged if you use this and your hands still glow. This, more than anything, is a learning tool for you to develop better techniques for yourself and other cleanroom operators. First things first, we must remove all jewelry from our hands and arms. Next, 797 states, remove visible debris from underneath fingernails under warm running water using a disposable nail cleaner. Then wash hands and forearms up to the elbows with soap and water for at least 30 seconds. I should mention here that many facilities have or are still using iodine scrub brushes. However, they're no longer recommended, especially the brush side of the scrub brush. According to 797, these must not be used. Lastly, 797 says, dry hands and forearms to the elbows completely with low lint disposable towels or wipers. Now this is a change. We do not want to use a hand dryer for drying our hands, as this creates unnecessary turbulence in our cleanroom, spreading particulate. While 797 gives us a very general procedure for washing our hands, let's take a closer step-by-step look at the procedure from the CDC Handbook, A Guide to Cleaning and Disinfecting Cleanrooms by Tim Sandel. This guide provides a systematic way for washing our hands and applying the alcohol-based surgical scrub to ensure you're not missing even an inch of surface area of your hands. I need to point out here that there are places often missed during hand washing and sanitization, so pay special attention to the tips of our fingers, in between your fingers, and the back of the thumb. Okay, after we've removed jewelry, wetted our hands and arms up to our elbows, and removed debris from under our fingernails, we're going to first apply soap and then rub the hands together palm to palm and rub each wrist with the opposite hand. Next, rub the back of each hand with the palm of the other hand with fingers interlaced, and vice versa. Rub palm to palm with interlaced spread fingers. Rub the backs of the interlocked fingers on the opposite palms. Rub the right thumb in the closed palm of the left hand using a circular motion, then repeat on the other hand. Rub the closed fingertips of the right hand on the left palm using a circular motion, and again repeat on the other hand. Rinse your hands of soap, then pat your hands dry with a wipe. Lastly, 797 states, hands must be sanitized with alcohol-based hand rub before donning sterile gloves. Sterile gloves must be donned in a classified room or segregated compounding area. After you've applied the alcohol-based surgical scrub, wait for your hands to dry. Do not wave them around to try to make them dry quicker. This will only shed more particles, or worse, you could pick up something on your just washed hands. Let's take a look at how much glow germ is left on my hands after using this technique. Not bad. This looks like a decent, systematic way of washing and sanitizing our hands. Now you're ready to finish garbing, starting with your gown. Let's check that out in the next video.